Good afternoon and welcome to Save Time, Save Money Saturday. For those of you that are following our hashtag, that's STSMchat. I'm Michelle Stinson-Ross from offers.com, and today we are talking about back to school and eye care and why it's necessary to make sure that our students are ready from a visual standpoint to go back to school. And today I am joined by Dr. Kayla Bechthold of Relf Eyecare. Dr. Kayla, why don't you take a moment to introduce yourself and tell people a little bit about yourself?
I practice in Duluth, Minnesota, and part of a group practice with optometry and ophthalmology. We see a wide array of people from 2 to 102, and I've been an optometrist now for 16 years, and I went to school at Pacific University in Forest Grove, Oregon.
Excellent, thank you. Also joining us as kind of our man on the street and color commentary, we have Mr. Rob Koroth. Why don't you say hi, Rob?
Howdy, guys. I'll tell you a little bit about me. I'm Rob Carwath. I live in Duluth, Minnesota. I have the pleasure of working with Kayla and crew at Relf Eyecare, and I also should say I'm a parent of 4, from 20 to 7, and so eye care with kids and back to school and family stuff is something I'm pretty familiar with too.
Excellent. Well, let's get right to this, because my first question for you, Dr. Kayla, is many schools across the U.S. still offer a free vision screening at the beginning of the year. What is the difference between that and an honest-to-goodness eye exam, and why do we need to know about the difference?
Well, a screening, it's good that they do them, and they do pick up some eye issues, but you can't be lulled into a false sense of security by a screening. They check actually for very little. School screenings usually just check distance vision, and a lot of kids don't have even any trouble with distance vision. Usually the things that cause the kids most trouble is focusing, up close issues with reading, that type of thing, which they don't really check for. Also, unless you dilate the pupils to get a good look in the back of the eyes, you would not know if your child has an eye disease. Kids can get eye disease just like adults, and so it's good to just check eye health. And it's very easy for a kid to fake a school screening. They're very smart, and they memorize the letters and they listen, and so a lazy eye or amblyoptic eye a lot of times gets missed until age 9, 10, 11, just because they just can't catch it. They're not trained to do that.
Mm-hmm. Do you want to go into a little bit more of why it's important to take your kid to an eye exam as part of the back-to-school routine, and what are the benefits of doing that?
Well, about 80% of learning is visual. And so, if your child's never complained about up close but has had any trouble with reading, etc., they really need to see well, both distance and near. And, a lot of kids are not going to tell you. They're not going to tell you that they can't see up close. They aren't going to tell you that, their eyes hurt to read. They just say they don't like to read. And so in order to get them in, get their pupils dilated, tell exactly what the prescription is, again, just safeguard against eye disease, like, amblyopia, lazy eye, crossed eye, and focusing issues, just so that they can do the best that they can at school. Mm-hmm. It's hard enough to go to school. My son comes home with so much homework, and he's only 8, and I just think, well, if there's one thing that we can take off of their plate, if they're having trouble with vision, if we get rid of that, it makes school a lot easier for them. It's easier to concentrate and pay attention and to learn.
Well, and from both personal experience of my own as well as with my youngest daughter, I can say that sometimes vision issues present themselves as something a little counterintuitive to, oh, that's a vision issue. I am farsighted, so for most of my day-to-day stuff, for driving, for walking around the house, doing chores and whatever, I don't need my glasses. I only need these when I'm sitting at the computer, which I'm doing right now. I've got text and all kinds of stuff really up close that I'm trying to read and focus on. And that's when I need my glasses. And I discovered that I needed glasses about junior high because and this is true not only of when I was going to school, but it's also true of kids going to school now, that in the elementary grades, we tend to have a lot of far distance. The kids are looking at the teacher, at the board, at something that she's doing up at the front of the room, and they don't have that much up-close reading. It's not until you get into junior high and that learning style shifts a bit and you are required to start reading more and more that up-close, my eyes are getting tired type stuff presents itself. I used to get headaches in junior high, and we couldn't figure out initially what the deal was. Same thing with my daughter later on. The first thing she started complaining about every afternoon was, "I got a headache, Mom, I'm tired." And it took us a while to catch on and go, oh, wait a minute. She's getting headaches every afternoon. Well, let's see if maybe it's a vision thing. Sure enough, her prescription is actually very, very similar to mine. And because we both suffer from this need to have some help when focusing up close.
Yeah, and a lot of times it'll be the frontal headaches usually, even watery eyes, burning eyes, if they're rubbing on their eyes a lot. Yeah, and like you said, they don't know. They're not going to tell you, oh, I'm having trouble focusing. And if they're never in for an exam, a student like you is always going to pass their screening, no problem.
Right.
But if you come in for an exam and we dilate your eyes, we can see that there's a lot of farsightedness there and be able to correct for that.
Certainly. That kind of moves me on to my next question. When should parents take the kids in for the first eye exam, and how often should you be doing follow-up eye exams once you realize there's definitely a need for correction there?
Guidelines are 6 months, 3 years, 5 years. Normally, a 6-month-old, you do get a good check at the pediatrician. They do look with an ophthalmoscope, and most things. If you're a parent and you have eye issues in your family, you'll be concerned about it. You'll get them in. If there's something, all my aunts and uncles have a crossed eye. Well, you'll probably get your kids in sooner. So usually 6 months is pretty straightforward. 3 years is when we like to see the kids. Normally, if a child is going to have strabismus or a crossed eye, it shows up around age 2. And so, right at 2, if we see an eye turn, normally most parents will bring them in. But at age 3, they can come in. If there's something subtle, we'll be able to catch it. And also they can cooperate a little better. It's easier for them to answer your question. They can tell you what pictures they're seeing. And for most conditions, if we catch them by age 3, that's good. We can prevent amblyopia, correct strabismus, address focusing issues, that kind of thing. And with our children's exams, we check depth perception, color vision, eye movements, as well as just prescription, and then getting them dilated. So if their eyes are dilated, we get a nice, accurate prescription. We know what their prescription is. But then also to check for eye disease. It's not very common, but retinoblastoma, you can have cancer in the back of the eye. You can have, cataract that you had no idea. So it is important to get a good baseline, and we do like to see kids about 3. And then after that, before kindergarten, right around age 5, we'd suggest another one. And the children that I see, if they're in correction, contact lenses or glasses, I normally see them about once a year, year and a half. But if they don't, if they're pretty much plain no focusing issues, nice and healthy, just kind of an eye health check, then usually every 2 to 3 years is plenty.
Okay. Another point, I have 3 kids, so we've had quite a bit of fun with vision over the years. My middle child has been in glasses ever since she was about 4. And with her, I took her in that early because, number one, we were noticing her eye was turning in a little bit. It's like, that doesn't look right. But we also noticed, even before that was really, really noticeable, she had been bumping into things in explosive way. Yeah, I mean, she would just like, and this was my very, very active child. She, even as soon as she was able to crawl, she would bulldoze through things. And we just figured it was her personality when she was crawling. But even once she was up and walking and running and whatever, she would go run down the hall and wham! into a door frame because
Oh no.
we finally discovered, oh, she's just not seeing that quite right. We need to take her in and have her checked. And honestly, that young, I was a little concerned about putting glasses on her face, but it was one of those things that the correction was so dramatic that as soon as they put the glasses on her face for the very first time, her face just lit up. She's like,
Yeah.
oh my gosh, I never knew the world looked like that. We have never had a problem with her losing or breaking or damaging or it, because for her, those lenses are such precious things, and they're on her face constantly. Do you want to address maybe a little bit of that kind of concern for parents with young kids, that they need it, but, you know, are they going to take good care of it?
Well, you know, it really, everyone is different. And, you know, the kids that take good care of their glasses are the adults that probably take good care of their cars. You know, with us, with contact lenses, it's usually always age 12 or older because they won't take care of them. With children, they have to, you know, they make glasses so that they can stand up to abuse. And most places will for sure give you a year warranty. I mean, it's always good to check when you're buying glasses, find out what your warranty is. And children's glasses, and I believe this is a national law, set up, but they have to be polycarbonate, at least for sure in Minnesota, and that is a safety glass, so they won't shatter, they won't break. So really, the best bet is just getting a very good warranty, being sure that they're going to replace them if they get mangled. But like you said, it's encouraging to an eye doctor when I prescribe something and I think, oh, that's really strong. I hope they're going to be able to adjust to it, because especially with high astigmatism correction, it can really make you feel sick to your stomach when you wear those glasses. And so when they put them on and they're just so happy and they take care of it, you know that you got a good RX for them, and it's encouraging. But yeah, you know, we know when the little boys come in and they're 7 and their glasses are mashed around their face and they're stretched up, you'd be amazed at how they can still see out of those things. I mean, you know, and it's better than nothing. But yeah, it's hard. You know, you just do the best you can, and bring them in to adjust them. Even if you don't get your glasses at a particular optical, anyone will adjust your glasses. Anyone will replace your nose pads. So if if there's a place that's close to your house that you maybe didn't even get your glasses from, you can bring your kids in there and they'll adjust them for them. So yeah, it's tough. There's no great way to keep them on their head, I guess.
I guess. Rob, do you have anything you want to add at this point?
Yeah, well, one of the things that, you know, as we're thinking about kids and families and eye exams, the difference between an optometrist and an ophthalmologist. Kayla, you have both at your place. What are the benefits of having both? Where should a family start? Is starting with an optometrist an okay place to start? What would you recommend there?
Certainly, I think it depends on, honestly, optometrists, ophthalmologists, there are some that love to work with kids and some that don't. And so in our office, when people call, they ask, you know, if it's a child, they kind of point you towards one provider or another. I think just in general, for the most part, if you go to an optometrist, really anywhere, Walmart, shop, I don't know if it makes any difference, as long as they're dilating the pupils and being sure to check eye movement and up close vision, those kinds of things, that's really fine. If there's a concern, if there's an eye turn, a lazy eye, a really high prescription that you uncover, something different, there are pediatric ophthalmologists, and here, you know, we usually do refer to our pediatric ophthalmologists. Their offices are set up, you know, just all for children, and if that child needs surgery or something like that, you need to hook them up with a good primary care MD. But yeah, you can get a really good eye exam, you know, at a lot of different places. You know, I think things just to be informed, because people, you know, don't really know what a good eye exam would entail. I would just ask, you know, if you're calling to make the appointment, ask if the provider likes to work with children. Ask if they check up close vision, if they check focusing, and then, you know, ask if they dilate the pupils. If those things are being done, you know, you should be getting a good exam.
Excellent. I know with my my middle child, the one that was bumping into walls at 4. We went to a pediatric ophthalmologist. There was enough going on with her that we figured this isn't your standard, because
Yeah.
she had never been able to see, and she would have never articulated, hey, I can't see that. She had no point of reference to go, oh, this is in focus, this is out of focus. It had always been that way for her. She just assumed that everybody worked that way. So for her, we took her to a pediatric ophthalmologist. Now, my youngest, who, didn't get vision correction until she was much older, she was much older. She was in junior high. She was able to be very articulate. I didn't have to sit there and help explain anything for her because she was old enough to take care of it for herself. And I was fairly certain, just depending on by what she was complaining of, that a visit to an optometrist was going to be more than sufficient for her.
Yeah, and in our practice too, I know that we're a little bit different in that we do very much work together. So if one of the MDs, has one that they're like, boy, I wonder which RX I would go with. We kind of go back and forth a little bit because, just historically, optometry spends a lot more time learning how to refract and do eyeglass prescriptions than ophthalmology does. Not to say that they do an excellent job, but sometimes it's just really nice to be able to divide and conquer those tasks too, and to be able to ask someone else. But we certainly do utilize our pediatric ophthalmologist as well. And if we see anything that we think, boy, that's just not quite on, we have no problem sending them on. And I think it's just honestly what you feel more comfortable with. Mm-hmm. I think if you would have taken your first child to the optometrist, but you had that kind of, you were kind of dreading about it, or you knew something was wrong, I don't know that anxiety would have necessarily gone away had you done that. I think you did the right thing. I think if you're really worried about something, you should just trust your instinct and go where you think you need to.
Well, at the end of the day, you're going to wind up actually saving yourself some money, because had I just gone to an optometrist and then they said, well, those are additional appointments that I didn't really have to. I could have skipped those and gone straight to the ophthalmologist in the first place.
Correct.
So listen to that gut. It'll wind up saving you some money and some hassle in the long run.
Mm-hmm.
Kayla, I have a question. So, the dentist is a thing that I think most parents get. Maybe the doctor, even if it's motivated by the sports physical that's required. Tell us how a regular relationship with an eye professional, with an eye doc, is going to help parents and their kids save time and save money. We've touched a little bit on it, but how is that preventative? How is that relationship and being able to create a track record with a patient? Ultimately, how does that save time and save money?
Well, honestly, the more you see someone, it does go certainly a lot quicker. You know what they look like. You have notes of what they've looked like in the past. You can tell how much change is happening. I think that just with any provider you go to, if you can stay with the same one, it just does save you a lot of time. When we're seeing new patients and we have to go through a lot of old records, it's difficult, and it's very valuable to be able to see that same person again. And even I like seeing families. I'll see all the kids and the parents, and so if their mom's optic nerve heads look really kind of weird, but I know she doesn't have glaucoma, I've checked her for that, and then I see her 3 kids and they all look the same. Well, that's kind of nice. I don't have to run all those tests on those kids. I know that this family, this is what they look like. And same with, let's say you've come in year after year. I know your family, I know your kids, and then a Friday afternoon you get something stuck in your eye. You get a sports injury, you get something. You have your clinic. If you get an eye injury, if you get an eye infection, an eye emergency, you just feel very comfortable being able to come in. You know your person. You know they're going to take care of you. That's very nice, and that does save you time and money. You're not going to the urgent care and then having them maybe not give you like the most accurate treatment and then having to come in and see us anyway.
Right.
So I think that's pretty valuable too.
Well, just having an eye doc or an eye doc place in your network of providers and in your network of helpers as a family, I think what you said about when you do need or when you have concerns, or if you have an injury on a Saturday, you've got a resource to call. That as for a parent, that gives me a lot of I feel confident. I feel like I've got somebody when I need them, if I need them.
Right.
Excellent. Good point. Thank you for bringing that up, Rob. You mentioned polycarbonate lenses a while ago. I wanted to kind of focus on that for a minute. And what is absolutely necessary with a pair of kids' glasses? What do we need to spend money on? Where can maybe we save a little bit of money when it comes to anti-reflective coatings, transitions lenses, sunglasses, the polycarbonate? Can you kind of go into that a little bit?
Sure. With kids lenses, again, I believe legally they have to be polycarbonate, and that's a shatterproof material. So you don't have much choice in the matter there. But most places do package deals. And a package deal normally is really your best bet. You're going to get your frame and your lens at a good discount. And for the most part, they're warranted for, I mean, I know most practices that I've worked at, they're warranted for a year. I can't say for everyone else. But that's normally, again, your best bet. There are, you'll see advertisements or articles, sunglasses, anti-reflective. Polycarbonate in itself inherently is 100% UV protective, without coatings, without anything. So if your child wears glasses, they are being protected from UV. If they don't normally wear glasses, you're wondering if you should get them sunglasses. Certainly if they're light sensitive, absolutely. Transition doesn't add any extra UV either. Transition just changes color. So again, if you have a real light sensitive kid, yeah, it's nice to put that on there. The studies have not necessarily shown 100% correlation between cataracts and UV light, nor macular degeneration. Now that could change in 5 years, and intuitively it would make sense if you're, have a bunch of UV light getting in your eyes that you would get cataracts. But they can't necessarily technically say that. Skin cancer, definitely, and skin cancer is really common around the eye, and we know that if you're exposed to a lot of UV light when you're a kid, you're much more likely to get skin cancer. So the sunglasses mainly, I mean, really would be mostly right now what we know of to prevent for skin cancer around your eyes. So again, you'll go in and sometimes some places will want, well, they have to have transition. Well, really, no. Again, if you have a very light sensitive kid, it's nice, but it doesn't add any value as far as UV protection. Anti-reflective coating, it cuts glare. It's nicer for probably older kids that have to do a lot more computer work, laptop, more and more school is being done on the computer, and it does help with glare. Glare can really be pretty debilitating. The thing with the anti-reflective, though, it's very picky. It will scratch really easily. So if you have a little one, it is not necessarily such a good idea. If you have a great warranty on it, and you can replace them as many times as you need to, go for it. Everybody likes, for the most part, almost everyone likes anti-reflective because it is more relaxing on the eyes. But practical, at least under age 12, probably no. And it doesn't, protect the health of the eye or anything. It just helps it to be a little bit easier on, computers, keyboards, that kind of thing. For adults, we sell it more for night driving. But, again, the 10-year-old's not going to be driving at night. So.
So Kayla, we are doing, all of us, a lot more screen work, spending a lot more time on our screens. Kids in particular, I think we worry for a lot of reasons that they're spending a lot of time on their screens. Are there any eye concerns specifically that we should be aware of or think about because of all the screen time, or things that you're seeing that are new or different because of the way we're living and the way our kids are living?
Yeah, I mean, it's definitely harder on the focusing system to be looking at a screen versus a piece of paper. Your eyes are constantly focusing kind of back and forth, and it can give, kind of the symptoms of farsightedness. I mean, you get the frontal headaches, the eyes get real tired, and dry eyes. I mean, I've been giving kids more artificial tears than I ever have, I think, because of that. So, you know, the main thing to do is to try to at least give yourself breaks from the screen, and that seems to be the most helpful. You know, I think OSHA guidelines are still like every 10 to 15 minutes you have to look away, you know, for a few seconds. And so really kind of sectioning off the kids' screen time, you know, you get your iPad for 10 minutes and then you're done for a while and then you can have it for 10 more minutes. Yeah, that does definitely seem to help. Don't necessarily, you know, have to have a separate pair of glasses for kids for computer. I mean, they would never find them by the time they needed to use them on the computer, you know. So really, just, you know, smart lifestyle things. I mean, if you can give your eyes a break, the focusing muscles can relax. They can look in the distance 10, 15 seconds. It makes a big difference, and then you can kind of get back to what you're doing.
That's good advice.
Exactly, that's a great tip, not just for kids, but for all of us adults that sit at a computer screen all day long.
Yeah.
Let's see, what else? I wanted to ask specifically about getting the best deal on a pair of glasses. Can parents get the same quality for a better price by ordering glasses online? Where is that beneficial? When is it beneficial, and when is it not so much?
You know, online you do not really have, you're sort of left to the wolves a little bit. There's no one really checking if the prescription is correct. There's no one really checking if the material is indeed what they tell you it is. I have had patients come in, I mean, adults and children, but children usually it's the worst. You know, their parents will get them a pair of glasses online, and they've had the pair for like a year or two, and come to find out it was not the correct prescription at all. And I even had to treat a kid for amblyopia because of that, because he had kind of shut his one eye off because it was so bad he just wasn't using it. And kids do not know enough to tell you. Some of them do, but if they're young kids, especially in their first pair of glasses, they don't know. And there's really, you know, there's something to be said for having your eye distance properly measured, having the frame properly fit, you know, to work on your face. You know, and you think, well, if I get them for $20, I can just, you know, throw them in. But if the lenses aren't what they say they are, there's really no recourse for you. And if they made them plastic, and then you get hit in the face with a racquetball or something, it's going to shatter, and you could, you know, potentially blind yourself. So I think in adults, you know well enough to take care of yourselves. You certainly can do what you think you need to. But for children, I just would not suggest that. I would look for, you know, with glasses, you get what you pay for. They're very inexpensive glasses. Are going to have a very inexpensive frame that will probably break on you. But yet you don't need a frame that's $300. You know, there's a designer section. There'll always be people who like designers, and great. You know, they can certainly spend their money on what they want. But I think a good middle of the road frame from a good place. I mean, it doesn't. I mean, I'm private, so of course I would say private. But you know, you can go to Lens Crafters, Pearl, Walmart. I mean, all of these places, they have standards. They have people watching these lenses. They're very picky about it. You know what you're getting. And then, again, what saves the most money is just being very savvy about your warranty and asking and making sure there's a warranty. Some people will be very surprised when their warranty was 2, you know. So with kids, you want a year warranty. And, you know, in buy one, get one, that's nice too for children. Then you've always got an extra pair if they mangle them up. But it's just, online is just my pet peeve. It kind of leaves you open for so many things that could happen, even again if they're real inexpensive. But you know, you want a good product. You want to know that what you're putting on your kid isn't going to potentially harm them. So yeah, I think I would not go. I wouldn't do the online. But there's a lot of places. And again, if they're an optical, they've got standards. They have to follow government standards and these ANSI standards, so that you know that you're getting something that will be safe and will work.
So maybe one of the best ways to save time and save money is to spend a little more on the upfront and develop a relationship.
Yeah, exactly.
Right. What about vision insurance? I know that's kind of a mixed bag. Some companies offer it as part of a benefits package. Some people have to do it privately because either they're self-employed or whatever. Where is the cost benefit with doing the vision care ahead of time? Does it help save money in the long run? What are your feelings on that one?
Well, it depends. I haven't worked with vision plans much now since I've been with the ophthalmology group I'm with, and I've been there for about 10 years. But before then, I would have to work with that. If there's only a couple people in the family and they wear glasses, I don't think it's necessarily such a good deal, because you're paying a premium each month to get your exam and to usually get like a certain amount of money towards your glasses. The drawback is you do not get to pick your provider. They pick it for you. And you don't really get to pick whatever kind of glasses you want either. They pick out certain frames that you can get, and they pick out certain lenses, and they're the most inexpensive. And if you want something better, you can get it, but then you have to pay the upgrade. And what I noticed when I was working with vision plans, and again, it could be different, and I'm sure all of them vary, but I felt like people spent just the same amount of money once they got done buying their glasses as someone else did on theirs. At our office, we submitted people's medical insurance, and for the most part, I mean, almost we have, I think it's like 10 or 20% cash. For the most part, most people's medical coverage does cover an eye exam, and I think people just don't realize that. They think because they don't have vision coverage that they cannot get an eye exam, and that's just simply not true. It's routine care, and so, I mean, Flash Blue Shield, Medica, Health Partners. If you call them, you can find out that you can get your eye exam covered pretty much 100%. If you have a vision plan and you choose to use, your medical insurance to get your exam so that you can go wherever you want, you can still take that prescription and go where they have your vision plan and get your glasses made, and it still works. What I think would be the best scenario to get a vision plan would be if if you have like 2, 3 kids, you're all in contact lenses, then, again, you can get your eye exam wherever you would like, but contact lenses, for the most part, they'll give you, what I've seen, they'll give you like $200 a year towards glasses or contacts. Well, contacts don't vary. If you buy them here, if you buy them there, they're the same. So you can get whatever contact is prescribed for you. If you paid $100 for your entire premium on a vision plan, and you get $200 towards contacts, it just pays for itself right away. That's kind of a no-brainer. But if you're just, if there's just 3 of you and you're all in glasses, sometimes you're almost better off just skipping it so you can get what you want and go where you want.
Good advice. Is there anything else? I wanted to focus for just a moment on things other than vision correction. I know we've talked a little bit about crossed eyes and lazy eyes and stuff like that. Not only did I want to touch on that a little bit deeper, but I also wanted to ask about eye exercises and vision therapy and how that all plays into a child's eye care.
Yeah, our practice is not necessarily like a vision therapy practice. I studied vision therapy at Pacific as a big vision therapy school, and so I know some about it. I do have some patients that I have worked with some therapy. There are some conditions it works very well with, and some that I believe it does not. And so, yeah, it's kind of on a case-by-case basis. So, for example, if you have a child who's very farsighted, a lot of times their eyes really go in because they're trying to focus through this prescription when we focus, our eyes turn in. So kids who have like the eye turn in, a lot of times if we give them their prescription and give them a bifocal to take care of the focusing, their eyes are straight. They don't need anything else. They don't need surgery. They're pretty much, they're good. There are some kids don't even have much prescription distance. Really, they can focus okay, but their eyes won't converge. So our eyes have to come in, and they have to focus. And so if you can focus, but you can't bring your eyes in, it's very difficult to read. And eye exercises work really well for that. You can train that in usually 6 to 12 weeks doing some eye exercises, and you don't need glasses. You can just pretty much fix it by doing pencil push-ups and making your eyes go in. But there are other things where, if the eye is pointing out and constantly out, I mean, there are other eye turns that just, they're not going to be improved unless they have surgery. And so you have to be a little savvy about that. I think that there's a lot of different opinions on vision therapy, from where it's all, which it's hocus pocus, it doesn't work at all, to that's the only thing that works. And you have to be a little careful about getting too far one side or the other. I mean, there are definitely things it works well for, but there are some things it won't work well at all for. Yeah, so again, it's good to be hooked up with an eye care provider that you trust, that that is going to give you some good advice on that.
Rob?
I keep coming back to that. I think, how do we save time and save money with our homes and our cars? And we usually develop a regular relationship with providers. And something as important as our eyes, it makes it even more important for us to think about, do we have somebody in our corner who can give us great advice, who's seen us and has that track record, and can know when to be concerned and when not to be concerned.
Mm-hmm. That does it for me as far as my formal discussion questions. Was there anything that you felt like needed to be added to the conversation?
Well, I think I just, again, I'm talking from my own tiny little corner of the world, so other people's vision plans might be just wonderful. I don't know. I'm just talking from what I've seen. I think that the main thing is to just really be a little bit savvy. People have to sort of be their own advocate in a way. Looking at your insurance plan, seeing what it covers, you may be surprised. Some of them even will cover LASIK. Some cover it 80%. Seeing what you have. You could be paying money month after month, and you're not using the benefits that you have. And you could look at an optical shop and think, oh, well, that place is going to cost $1 million. But you go in and look, and it's actually really quite reasonable, and really does a good job. So just to be savvy, think outside of the box a little bit, and just to realize how important. I mean, eye care is very important. I can't remember the statistic. It's something like 90% people would rather lose their hearing than their sight. I don't know. It was a ridiculous percentage. So when you think about that, I think it's worth it to, just take that time and be informed and get your eyes checked.
And I like the idea of shopping around, too, that you don't always have to go to what you perceive might be the cheapest place. Our discussion about online options is a great example. And even if it out of pocket ends up being the cheapest in the long run, is that the right thing? Just being a good consumer and saying, hey, look, eyes are important. My kids' eyes are important. Let's maybe take a look at 2 or 3 places, or at least make some phone calls and see what the options are before making a decision.
Indeed. Well, Dr. Kayla, Rob, thank you very much again for joining us for Save Time, Save Money Saturday. I hope you guys have a great weekend.
Thank you. You too.
Thank you.